So we're here today to talk to you about a transformative healthcare initiative. We feel that with respect to reducing the incidence of cardiovascular and kidney disease, this is the most important healthcare initiative ever in our community. So to explain our vision, I would like to introduce Dr. Kadri, our medical director and clinical research lead. Dr. Kadri saw the need to change the way specialty care is delivered in our community, and he began campaigning in 2011. So please welcome Dr. Kadri.
Really thank you guys for attending tonight, because this is so important to us. We've been working very hard at this for several years. Our goal, first and foremost, is to find a way to make improvements to our current healthcare system that will allow us to provide more efficient and more effective specialty care for high-risk cardiovascular and kidney patients. That's been what we've been about for the last few years. We saw gaps in the system that we felt needed to be addressed. We have a lot of talented specialists in our community and primary care practitioners. But we felt that the system could be improved to try and help coordinate care better, to try and help improve outcomes for patients who are high risk for cardiovascular and kidney disease. And that's why we started working on this. Our primary care partners are the most important people in providing care for patients in this community. They are the quarterbacks of the system. It's our job as specialists to provide them with comprehensive care maps for their patients to allow them to do their work more effectively, to allow them to help enlist patients in adopting therapies that we know can make a huge difference in reducing cardiovascular and kidney disease. And we see primary care practitioners in our community as playing a central, pivotal role in helping us achieve our objectives as an academic research institute. Along that line, several years ago, we felt a need to partner with the University of Windsor to become more academic, more research focused. And that's when my good friend, Dr. Maher Al-Masri, and I started collaborating, communicating, and started to embark on doing more clinical research. And I can tell you, as a physician working in this community, without someone with the expertise that Dr. Al-Masri has, doing research is very difficult. He was like a godsend. We'd have ideas and we wouldn't know where to take them. And he would show us the path of how to get there and how we could do research in a community like Windsor. That research didn't need to be confined to academic centers like London and Toronto, that we could do it here, and we can do good work here, work that makes a difference, work that people in other centers began citing. So that's really all, the credit for that really goes to Dr. Al-Masri and his passion for getting involved in medical research, and it's been a tremendous, tremendous partnership. And that's what we really want to do. We want to establish an academic research-focused institute that will help us provide more comprehensive specialty care, coordinated, efficient specialty care for patients. And we think that that is the way to go, and we feel a single site, comprehensive, multi-specialty, multidisciplinary center is what we need to do. And shortly after we began evolving this in 2011, we were very pleased to see that the Ministry of Health endorsed a vascular health blueprint for Ontario that had all of the principles essentially that were in our model. So we knew, it confirmed that we were on the right path. And so we were very happy to see that. And then with our model that I'm going to explain in just a few minutes, we're hoping that if we set this up properly based on the principles that we believe in, when putting patients first and looking at the challenges that patients have and trying to help them overcome those challenges, that we can come up with a model that could be extrapolated in other parts of the province. This is innovative, it's new, we're very proud of it. We think it's something that really doesn't exist anywhere else in the province. And if we can prove through appropriate academic research that this makes a big difference, and that's what we're looking to do, hopefully this is something that other communities will be able to adopt as well. So having said that, I'd like to go over the model with you. Okay, so the need, there always has to be a need. We wouldn't want to change anything just for the sake of changing it. What we've noticed here over the years, and I'm sure you've all heard this, that in Windsor and Essex County, we have among the highest rates of cardiovascular and kidney disease. And as a result of that, we see a need to try and do things better. And we think in order to do things better, that the system itself needs to be transformed based on the available evidence to transform it. And so, so we feel the system needs fundamental change. Now, when we look at a patient, and in a minute you'll hear from one of our patients, but I can tell you on a daily basis, I have patients in my office that have multiple medical conditions coexisting together. Sorry, I'm on call. But patients with vascular disease tend to have multiple coexisting medical conditions. Tim can attest to this as a family doc. Hypertension, diabetes, heart disease, heart failure, chronic kidney disease, mini strokes and peripheral vascular disease tend to happen concurrently in the same patient. One patient may have 4 or 5 of those conditions that they're trying to manage at the same time. And their journey through our system currently is quite onerous. And honestly, if you a doc that's ever dealt with these types of patients, you hear it when they come to see you. You feel it when they tell you what they've had to experience. Care where they'll see their cardiologist at one point in time, and 3 months later they may see their nephrologist, and 2 months after that they'll see their diabetic specialist, and after that a vascular surgeon, and after that an internist. And each of those visits tends to be very siloed, right? Records aren't really shared in real time. Each visit is tagged with different lab investigations or imaging tests. It could consume all of their time and energy. And people regularly in front of me say, I spend all my time seeing doctors. And geez, I really wish our doctors would talk to each other. One doctor might stop this medication, another doctor will get upset and say, no, you should have started that, you should have been on it. And so that communication, even though it's well-intentioned, sometimes when it's not optimal, things can slip through the cracks. People can end up in emergency rooms, and people's conditions can deteriorate if the access and timeliness of care is not optimal. And we see that happen all the time. We see the strains on our emergency rooms, and on hospital admissions, and on families and family members that have to deal with that. And our goal is to reduce that burden on patients and their families by trying to coordinate care at a single site, multi-specialty, multidisciplinary center, where a lot of that can be made more efficient and hopefully more effective for patients. So to give you an example, if I see a patient in my office for their kidney disease, and I think their kidney function's stable, but as I'm examining them, I say, geez, you know, it looks like your heart failure is getting worse. Instead of waiting 3 months to see their cardiologist at their next scheduled appointment, they could see them down the hall that same day. Instead of having duplicate lab tests for every doctor's visit, that they could come once and it would be shared with everybody. When they come and you have a single electronic medical record, any change that's made is visible in real time to any other physician that's caring for that patient. You know, We're looking to make things more efficient and more effective for the patient. And any model, if it's going to be effective, it needs to start with the patient in the center. It needs to be patient-centered, not provider-centered. And that's what we really need to shift to, is that type of thinking. So our current healthcare system, as I mentioned, oftentimes because of, a lack of optimal coordination, we have such talented professionals in our community. I think a lot of times we're just looking for better ways to do things to help our patients more. But because of the lack of optimal coordination and timeliness of access, we notice that it leads to increased ER visits, increased wait times, inaccessible files, polypharmacy. Patients on more medications than they need to be, adverse reactions as a result of those medications, discontinued preventative therapy. Did you know that we have so many therapies at our fingertips to help reduce cardiac and kidney disease, vascular disease, reduce heart attacks, strokes, heart failure, progression of kidney disease? But only about 50% of patients are on the therapies that they should be on, because a lot of times they're discontinued for one reason or another and never restarted because people don't know why they were taking off of it in the first place. A lot of times it centers around an ER visit or a hospital admission, and things that could save people's lives and improve their quality of life and longevity are no longer therapies that patients are on because of that. Duplicate labs and imaging and increased acute complications. These are things that if you work within the system, you see happening regularly, and we see the need to change that for the better. It's not that what we're doing isn't good. It's that what we could be doing could be better.